Well, good afternoon. Good afternoon. This is Hurricane H, and welcome back to another show at the iHealth channel, iHealth Radio. Today is a special show. We have a special guest, as usual. We have Steven Rivera with us, who is president and CEO of OTC Mobile, OTC Stores, and Sentry Management Solutions. And today, the topic that we're going to be discussing is specific to the managed care industry and logistics and services that actually pertain to the actual industry and service the members of the industry. Before I get started, I want to just to obviously, the topic of the hour, we're still under quarantine for the most part. I mean, some of us have started to get back into the regular business and swing of things, but in the meantime, there are still a lot of people that are in their homes, working remotely, reluctant in going on the field. There are still all our good, frontline workers working out there doing their best to keep people healthier and safe. Again, from this platform and with my guest speaker here, we want to wish everybody to be healthy, safe at home or whatever they are. We want to thank all the frontline service, workers out there, anybody that is out there in the front working, whether it's in the medical field, the EMS, the nurses, the doctors, the radiologists, the tech folks, the paramedics, fire departments, law enforcement, logistics in general, which is our topic today. So again, everyone, thank you for all the work you do. Keep it up. We appreciate everything you do to help everybody stay safe and healthy. That being said, we'll turn into our topic of the hour. Again, the managed care industry, for those who have watched previous shows, we talk about MCO world and the managed care organizations. We talked about all the details. But as every session, we talk about different things and different elements of the business and the industry. And today is a combination, again, of the MCO world, but specifically the innovations within the actual industry. So our talk show today is Innovate, and that's a series. And we will talk about what's the innovation in the industry. And a lot of things actually are happening in the managed care, and it's been happening for years. And as the demand, as the interest and the needs are available and pertinent, companies come to light and bring in some services that are unique, that are actually very, very beneficial to the communities. And of course, that health plans can partner with and utilize their services in the real life. And so today specifically, Steven Rivera, who's again, as I stated, the president and CEO of two companies, literally, OTC Stores, which is actually a component, and we're going to talk about that in specific details. Steven will tell us more about that. And he's also the president and CEO of Sentry Management Solutions, another logistic and services, platform. And we'll talk about the two and the interests out there. How does it work? How does it relate to health plans? How does it work with members? And any other type of questions that can bring, and highlight, this information to you, whether you're a consumer or a professional in the managed care world, or any other company that might be interested in some of these logistics. So, Stephen, first of all, I know you for quite a while. It's been over 25 years since we
Yeah,
met. We've worked, across the platform. We've worked, in partnerships, from the hospital and health plans industries, consulting, you name it, we've done it. And today, we're gonna want you to introduce us a little bit more than just what I just did. So tell us about yourself and your past experience.
well, Hisham, you just the entire world how old I am, dating us back to 25 years.
Oh,
So
we were 1 year old when we met. That's
we
it.
were babies,
Yes,
yeah.
babies. That's right.
But yeah, definitely has been a long time that we've known each other and we've been in this industry for such a long time. And I think we've learned a lot and seen this industry grow in healthcare. I think we've experienced it all up until this year, where I think not only just us, but the entire world experienced something that has been phenomenal in regards to this pandemic. And it's definitely has taken its toll on not just America, but the entire world. And we're experiencing something new. But I have to say that with this particular pandemic, there's one silver lining here, is that for the first time ever, healthcare workers are being highlighted and being praised as heroes. And
They are.
you know, and when I look at it, they've always been heroes, but never given that recognition. But it takes something like this, which has been horrible for many American citizens who passed away, or families and friends who lost loved ones, to finally realize how important healthcare is. And you and I have been in healthcare for over 25 years, helping families get health insurance to provide better, healthy living through the insurance programs that we've participated in or pushed. So there is this silver lining to finally say that people are being recognized in this industry for stepping up, and have always stepped up. And for everybody, I realize, and you made mention about all the essential workers that are in healthcare and so forth, but I realize too that essential workers have gone into restaurants, supermarkets, people that are still out there working and trying to give us a sense of normality, because everything else is closed, and they put themselves in harm's way every single day. So it's amazing to see what we're going through, and how we still have to be focused and try our best to give something to this community in healthcare. I think there's going to be a lot of, once we overcome this, there's still a lot to go through over the next couple of months. I don't think we're going to see normal anytime soon, but I think it's going to kind of open up a lot of discussion about healthcare and how important it has to be here in the United States, and things that we have to do to provide better service, better logistics, right? How to improve our services, how to be innovative, how to create new initiatives. And I think this is a great opportunity for companies such as, my two companies that are involved in healthcare as a vendor, to step up to the plate and provide more services to their contracted plans and to its members.
So thanks, Steven. So again, just to tag in right from there into the actual details on the companies. So we know that health plans operate, and as I mentioned before, in a different way. So there's different departments, there's different things and services needed to actually service the members. And we talked about customer service and the importance of that. And the two companies that Steven is going to discuss today actually really touch on that a lot, because they really are in the front line of what a health plan does for the members. So some of them are directly towards whatever their benefits package looks like. And the other one is actually, it helps them really get their care. And, I don't want to give the details because I want to give Stephen the opportunity to talk more. I mean, I certainly can break it down, but nothing better than coming from the man himself. So tell us first of all about OTC stores, and, first of all, the idea, and then like where it is today and where do you see it going? And then we'll take it to Sentry.
All right, sounds good. Thank you so much, Hisham, for even having me on the show.
Oh, thank you.
And being able to put my businesses, on your network, and to be able to, explain to people what we're doing and how we're doing it. Like you said, I've been in healthcare now for a little bit over 26 years now. And, my career has taken me from working at the city hospitals of New York to working at the health plan level, both at Health First and at Health Plus, as vice presidents in those companies. But, I have to say, opening up my own businesses have definitely taught me a lot, has given me the opportunity to learn exactly what is needed from a vendor's perspective to a partnership perspective to a health plan. And I think one of the things, and we'll talk about the two companies, but I think one of the things that we wanted to focus on when we opened up both companies is really being a true partners to the health plan. I think coming from the health plan side, and Hisham, this, and those who are listening to the show understand this. When you're part of a plan and you have many contracts with different vendors, I remember my experience with vendors was they were just vendors. When I opened up my companies, I didn't want to just be a vendor anymore. I wanted to be a vendor partner from the plan, meaning sitting down with the health plan and those plans that gave us contracts is really understanding how can you tap into my resources? How can we take a look at what you really need? And how can we expand on your actual business? How can I give quality service, but then also help you with your growth, help you with what your needs are, give you, be an extension to your company. So this is what we kind of created in both companies. So OTC Stores has been around now since 2014. The main focus of OTC Stores has basically been to provide a different type of service when it comes to the over-the-counter products, which is what OTC. As you know, many health plans provide their members with a OTC benefit that allows them to purchase over-the-counter products. What I saw before I opened up OTC Stores is that a lot of members, used to go to the, to the Rite Aids and Walgreens and the pharmacies, and they used to come across a lot of issues, a lot of problems in regards to identifying what was an approved OTC item. If they had certain questions on the benefit itself of the product, or a better understanding of how to work around the benefit, they never used to get that help, because when you go into these stores, their objective is just get you in and out, right? What you want, how you need it, let me charge you, and off you go. And what we did with OTC Stores is that we wanted to create a compliant company that makes it easier for the members to have a experience. And that's why our tagline is more access, more benefits, because at the end of the day, we want to make sure that the member is really understanding how to use their benefit and how to access it. And it's an education component that we provide. It's a retention component. I think a lot of the health plans understand that if a member utilizes their benefits correctly month to month, then guess what? That's a form of retention right there. If they're happy with their health plan, they're happy with their OTC benefit, and they're happy with how they're accessing their OTC benefit, it's a way for them to be retained with the health plan. But OTC Stores itself, as I said, since 2014, we have a three approach step in regards to how a member could get access to the OTC benefit. The first, of course, is a online website where they can actually go online, and we design the website specifically to the health plan specific needs, where they could actually go online and shop for the items that are approved. Now, every item that we have in our website is CMS approved products. So if they see it, that means they could buy it. There's no questions about whether it is if it's an acceptable OTC product. We have a call center. Our call center tends to the seniors as if they were their own parents. We take our time speaking with the seniors, and I think anybody who's listening to the show knows that whenever you work with seniors, expect to be speaking with them for many minutes. So what we've done is that we allocated that amount of time into our seniors. So we're not trying to rush them off the phone. We give them the time to really go through what they need, what their needs are, and we allow them to shop with us, at their convenience. A lot of times seniors call us and they talk to us about everything from their cats to their grandchildren to their kids. We hear the stories. You know about that, right?
we get that on this side as well, the helpline side.
Exactly. So, we take our times on the phone. Center is trained. We have the main languages available, which is English, Spanish, Chinese, and Russian. So we keep the top languages available. But of course, we service everybody. And then we have OTC mobile stores. So, I know people think mobile stores, they think phone. No, these are actual vehicles, RVs, that go out into the community and allow for members to shop at the vans. The vans are more of a marketing type of tool to work with the health plans, where we're able to go to events, be able to go to a social daycare or a senior center, park in key marketing location. And because we're a retail store and we're not regulated by CMS in regards to like a schedule, we're able to put our vehicles in different places. And because we're not a health plan and we don't solicit, members to enroll with us, we're providing a service. It allows us to really work with a lot of different entities and with no issues, because we're providing service to any member. So it gives that that good feeling that we're here to help everybody. OTC stores is not open to the public, Hisham. So we don't service people who are not in the health insurance programs, and we don't sell anything that's out of the CMS regulations in regards to the OTC products. So, if our vans are in the community or we're, in a senior center, then our job is to strictly focus on health plan members that have the OTC benefit. And did that because we didn't open to the public, because then that takes away from our concept, which was to originally provide a true service to the health plans and to their OTC beneficiaries.
But Stephen, as long as they do have OTC membership or an OTC card from a health plan that is participating, they can be serviced with you and through your company, correct?
Okay, correct. Yeah.
Now, in addition to those, am I? Is it okay for me to state that you do also deliver to the folks?
Yeah, yes. I'm glad you actually mentioned that. Yes, you're absolutely correct, Hisham. Those members who call through our call center and go online, we provide them with home delivery. That is correct. One of the things that we're doing, and we've successfully are doing it now with a health plan in Philadelphia. We're taking care of their entire membership, and right now, members are so happy because of the COVID-19, where no one is able to come out. Members, we have a long list of members that actually required us to submit their comments back to the health plan to tell them exactly how happy they are with the service. We had members crying on the phone because they just couldn't believe that they had this access. Members so joyful because they can't see their family members. Family members couldn't come to them. It was just a tremendous story and true testimonies that I've been able to read from my call center team to see how serious this pandemic has been, and how happy I was that we have this company providing this type of service, because we treat them like family. And to see some of these testimonies from these members and what they're experiencing, I just it really, when we presented it to the plan, and we presented certain comments that these seniors are, Hisham, they're tough, they're tough.
But they're lovely. I mean, they when they love you, they love you. I mean, they really cherish you.
Exactly. They forced us. They're like, you better get back to me and make sure that you told the health plan how happy we are, But it was great, during a time like this, that, thank God this health plan had a contract with us to be able to provide the service, because their members have been very grateful for the service and on-time service, and the fact that they could just pick up the phone and have that access. It's been tremendous. And Hisham, as you may have known, I think some of the major issues that we were faced with, and I think you as a regular consumer have seen it when you walked into stores like Walmart or Target, where they didn't have products on their shelves, because of distribution issues. This is
I couldn't find the stuff myself.
Yeah, this is real stuff that happened. We made it our business to give these seniors what they needed. Working with the health plan, made changes to their catalog, but it was nonstop. It was fast turnaround time. These seniors were truly happy that we found substitutions for items that we couldn't find because the entire world didn't have it anymore, right? They were just truly happy with the fact that we just didn't forget about them. And I think that was the key here. They weren't forgotten. We provided the service. They still had access. It felt like nothing was interrupted in their service. And I think that's the biggest key here.
So that's excellent. And one of the comments I wanted to make is this is OTC items only, right? So this is not prescription. So you're not doing any other pharmacy stuff. You're just doing the actual over-the-counter items, and that includes anything from toothpaste, I guess, to Tylenol and on the list.
Correct.
Right?
Yeah.
Just to be clear, because some people may have heard the delivery and they think, okay, I can get my prescription to OTC. Well, no, it's not the way it works, right?
Yeah. We're everything is over the counter, non-prescription items, from Tylenol to NyQuil, to certain medicated, body washes, facial creams, things that have some form of medication, that allows it to be, an OTC CMS approved item, we sell. And what we've done is that we've really taken the CMS categories, because CMS only puts it into a category. But
Mhm.
what we've done is find the actual products, because a category could have hundreds of products, brand names, and so forth. What we've done is make much easier for the consumer to understand what is a CMS approved product, because most plans give them a category, but we broken it down to, hey, you can actually get this particular product in the category.
Very nice, very nice. All right. So we talked about member satisfaction, and that's the biggest, one of the biggest things. A time like this, where you were able to deliver, these things that were scarce, in stores and things, that's unique. And so you said also the plans are actually really loving it. And now you're only right now in Pennsylvania, or you're in a different, state as well?
So right now, with the way everything was going this year, we put a focus in Philadelphia. Our focus has been Pennsylvania, Philadelphia, the 5 counties surrounding that. It is a large membership, and we want to make sure that 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 membership gets that they need. We're servicing about 16,000 lives,
Wow.
in that community, and it's been tremendous, and we wanted to put that focus, with with that membership.
All right. Well, there you have it. And again, members, of health plans, you do want to check if your health plan does have a benefit of OTC, and if they do, in Pennsylvania specifically, I guess now it's Philadelphia. You will be able to benefit from these great services. Now, that takes us right into the other logistical nightmare, which is, typically for health plans. I mean, part of their benefit packages is to provide some sort of a transportation service. And that is a big thing, because there's a lot of stuff, a lot of components that go into transportation, setting it up from A to Z, the network, this, the platform, the communication, the customer
Yeah,
service. So all that stuff, you've done it. You've created an actual platform. You created a system and a company that does that for
correct.
years now. Why don't you tell us a little bit about Sentry now?
Absolutely, thank you. And Sentry Management Solution was just something I came across, and I had no plans to getting into the world of medical transportation. I understood OTC very well. Um, so the way Sentry came about was quite unique. When I started my OTC company, a good friend of mine asked me to help him out, improve his transportation company that wanted to get into the medical transportation business. And, I took the opportunity to kind of understand from a transportation vendor side some of the woes that they go through. And coming from the health plan side, dealing with the brokers, I kind of heard, a lot of the nightmares that our members was going through.
Oh yeah.
The long waiting time, I remember, in transportation, and, listen, I know that it's true today. It is one of the top three reasons for, disenrollment for a health plan. And, you know, I never understood it. New York City is filled with taxis. So I just didn't understand, why people have to wait, over 2 or 3 hours for a vehicle to show up. So what I found this interesting was it gave me a chance to kind of understand from a transportation provider perspective, you know, what they experience, because I already knew from the health plan side what goes on. I knew from a hospital side, because coming from Health and Hospitals Corporation, I saw what, transportation was like. So seeing it from a transportation provider side, kind of helped me kind of close up the loop. And when I created Sentry, I knew that there was certain elements that we're going to be required to come up with a real solution. I think one of the things that a lot of people don't understand, and when you start a business, you want to have something that's a real solution, something that makes sense. You just don't want to be considered just another vendor. So when we created Sentry, one of the first things that I wanted to make sure we had was better technology. And I think one of the things that we see now in healthcare is that we are moving more into technology. And technology, if you think about it, has been this pandemic, hasn't it? Look at us. We're on video conference. Zoom has taken lead right now.
The world has changed.
The world has changed, right?
And will change forever.
Yeah, and it's been about technology. You got kids doing schoolwork from home on Zoom. So technology is key to performance, to data exchange, to real-time information. And what we did with Sentry was that we created real-time information. For the first time ever, health plans could actually see the status of the trip. They could see who's the driver, what's the make of the car, which company was assigned to that particular member, and you could see if the member was picked up or what's going on. And we did this because I remember the horror stories where the health plan would call the broker. The broker would say, hold on, let me call the transportation provider. And guess what? The health plan was there waiting with the member. And it would take 20 to 30 minutes to get information back. And then on top of that, then it was, okay, you got to wait another 30 minutes to receive a car, or another hour. So we said, you know what, we've got to eliminate this. So when we created Sentry, I took a look at a few things. One was the network size. So I wanted to not only bring in a network that meant something, I wanted inventory. I didn't want to just tell a health plan, I have 300 contracts, right, with 300 different transportation providers. I wanted to say, I have 300 contracts, but guess what? The inventory is this amount of vehicles, because it's about how many cars you have, So, when right before launching Sentry, we wanted to make sure that we had all those things in place. So we had the network in place with large count of vehicles. What we did differently, Hisham, was that we're the only broker that is endorsed by the New York State Taxi Federation of Drivers. Nice. And what we did there was that by working with the Taxi Federation, we identified companies that weren't involved in the medical transportation business. We helped them get involved in the medical transportation business. And by bringing that on, we brought on companies that had large inventories of vehicles of 300 to 400 vehicles, a company.
Wow.
So this gave us a large inventory of vehicles. And then our technology was key. But there's one element that I always knew has worked, but I had to make sure that the team did it. And I'm very blessed. I have a great team at Sentry. I have a great team at OTC stores. And one of the things that we made it our business is that network is great, technology is great, but the most important thing that we could deliver to a health plan is a partnership. So one of the things we make sure is that the team works very closely with the health plan. So, we assign management team to the plans. They handle all the implementation process, and we continue to, just every week, just work with them and provide updates, give information, just keep them abreast of what's going on. Like we keep transparency with the health plans. And I think is the success of our company, is that we have such a close relationship with the plans. We talk things out, we identify the issues, we bring issues to the table, and a lot of health plans that we're contracted with have come to us and say, hey, can you look into this? Can you do analysis on this? The team at Sentry is quite unique. And we've excelled on that particular part, Hisham, of just building a unique relationship with the health plans. Sentry, we've actually started in June of 2016, so we're approaching our 4th year. We came into New York City. We service right now a little bit over 50,000 lives through the contracts that we have right now. We I took something a little bit different out of Sentry. So we just don't have contracts with health plans. We have contracts with certain non-for-profit organizations like RAIN and Mid Bronx, Mid Bronx Senior Citizens Mid Bronx.
These are community organizations in New York City.
In New York City, yes, and we also have contracts with hospitals as well, where we handle the transportation for hospitals. And one of the hospitals that is the epicenter of the pandemic, Elmhurst Hospital, is one of the hospitals that we're contracted with.
Yeah, I mean that they've been hit hard, in that area. So
Yeah, yeah.
no, wow, yeah. So you have 50,000 lives. How many? I mean, those are some plans that you actually have contracts with.
Those are the contracts. Yes, those are the membership under the plans we're contracted with.
And those are for members that are Medicare or long-term care or both.
So
Or
these are the majority of these contracts are MLTC and MAP plans.
Okay. All right. Okay. And and you service all the area of the five boroughs or other
New York State.
parts of New York State, the whole state.
New York State, yes.
So how far up you go? All the way in
Up,
Niagara
up,
Falls?
we're on we touch the border of Canada and New York,
Wow.
so
All
far,
right.
yeah.
Well, that's great to know. I mean, so technically between the two companies, you're covering Pennsylvania and you're covering the whole state. I mean, that's pretty good, I would say. And, that's a lot of lives actually that really rely on your companies and services to actually get them from A to B. And just to clarify to the audience and the viewers and whoever is listening on the radio, the transportation benefit from health plans includes ambulance, includes regular vehicles to take you to
Correct.
medical appointments, dental, things like that. So this is not just a cab driver type of thing, but it's more than that. I mean, there's ambulance, and then there is the regular livery type, right, Steven?
Yes, you're absolutely right. During this COVID-19, we supplied masks and gowns and gloves to many of the drivers.
I was going to ask that question.
Yeah, we gave them kits, Ziploc kits, where we put masks and we put gowns, we put gloves in there. We try to do our part. We know that they were considered essential workers. They had to go out there, the ambulance drivers. Even our ambulance companies, and this is how serious it was, Hisham. When our ambulance companies was reaching out to us for supplies. So when you hear it on the news that there's a shortage of masks and no access to items, it's a true thing.
It's scary. I mean, again, it has been unprecedented. I mean, it's not something that the world has seen before. I mean, maybe in a different light in a different time of an era, but in the modern world, I mean, it's been crazy, and nobody's seen it like really happening the way it happened. People talked about it, but companies are being faced daily to actually really make things happen in real time. And you come up to you rise to the occasion, accordingly, when this happens, and you guys did, and I'm pretty sure people are very, very, thankful for all the work and the help that you guys provided as services, and I'm sure the plans actually are also satisfied and happy because you were able to assist them during this tough time.
No, absolutely,
So,
absolutely, and these things, what I found was that, this caught us all off guard. Nobody knew what to do. There was, I think we all have, readiness plans, but nobody had a readiness plan for
to this magnitude.
yeah for COVID. I mean, this was beyond. This caught everybody with their pants down. And it was just for everybody to work together and try to figure things out. And I'm glad that right now things are kind of smoothing out a little bit. Let's see what happens once communities are opened up again and people are able to come back out and go to places and start crowding again. But let's see what happens.
So have you seen a decrease somehow in the actual daily volume of your activity? So there was an impact.
Absolutely. On the transportation side, yes, there was a definitely major decrease. And I could just sit here and tell you that this decrease is a domino effect, because if if we are not giving transportation providers trips to take people to the doctors, then that means that, these transportation providers are not getting, of course, any revenue. And if they're not getting revenue, that means that these health facilities where we were delivering the patients to, if they're not doing telehealth, then they're not seeing the patients. If they didn't have a cap service in place and they were fee for service, guess what? Unless you had a PMPM, contract with the health plan for your as a medical provider, and you relied on fee for service, then definitely these last 2.5 months you were hit hard.
Real bad economic impact. Wow.
Absolutely.
Well, I mean, listen, it's been tough. I mean, across. But so do you see, hopefully now with everything that's opening up a little bit, do you see a light at the end of the tunnel, as they say?
Listen. I see my reports. My I get daily reports for the number of trips we're gonna have for the following day. I sort of pick up a little bit this week. I would assume that we're going to see a very large peak once everything opens up, because you're going to have people who had to reschedule their appointments, had to reschedule their visits. People who are afraid and going to want to go to the doctor now. I see probably once we're truly open in June, because there's an extension in New York City now for June 15th, right?
Oh, really?
Yeah.
Again, for
So
the audience, I mean, some people may not have known, but that is crazy, actually. Yeah.
yeah, so I I probably maybe in July we start seeing a pickup, in the transportation trips once
In the
everything
meantime,
opens up.
are you looking at maybe expanding your contracts, across other, opportunities within the
Actually,
state?
yes, we're in a RFP right now, to expand into some other states. And I have my eye on Pennsylvania. We want to come out there and provide service out there. Over the last couple of months, I've had a chance to get a better understanding of Pennsylvania and in the Philadelphia market, and we want to get out there. In New York State, we are under our transportation brokerage company. We are a certified minority-owned business, by New York, recognized by New York State. So we hope to expand that into the Pennsylvania and other states, because in these other states they do take that certification quite serious, and they want people to they want vendors that have the minority certification, to because based on state contracts they have to give a certain percentage,
To,
and not too many companies qualify for it, Hisham, and that's the key. Not too many companies qualify for the minority certification, but we did qualify here in New York. In New York.
and then just again for clarification, that companies is a minority certified, and but services everybody,
Mhm.
all communities at large,
Yeah.
and the benefits are general and public.
Yes.
And so best of luck in the expansion, and the hopefully getting some access to those states, as well as providing these key services to the communities within those states. And again, I mean, it's great to hear that all the impact that you've had, the positive impact that you had over the last few years, from ideas that stem from the fact that there was some lack and deficiencies in the process and the logistical approach, and you came up with innovation, something different, something maybe not a new thing, but it's a twist, a spin on
That's
things,
what. Correct.
something,
Just
an
just
improvement.
adding more. Just
Yeah.
adding more to it. One of the things we also did too, Hisham, in regards to the transportation, um, portion, was that you know many of the contracts that we were able to win, we started off as the second vendor. We introduced to the health plans about bringing in a second vendor. Most plans were used to just using one transportation broker, and we basically said, there's nothing new from keeping you from having two vendors,
As a
and
backup,
as a backup, absolutely. And one of the things that
overflow. Yeah.
we show them, hey, as having a secondary vendor, when you feel that your primary vendors failing maybe in a particular area that they're not strong in, give us that and let us prove to you that we could provide the service. And, that's what we did, with certain territories that they needed, assistance with, or whether it was a grievance, one health plan gave us all their grievance members. So all their members that ever complained about
Yeah,
their
the tough ones,
transportation
huh?
service. Yeah.
That's
And we took it on, Hisham. We took it on because, you know what? I want to prove that we are a true solution to transportation. We took on all their grievance members, and the health plan reported back to us that there was a 67% drop with those members with the grievances.
so that's actually
Significant.
a
Yeah.
67% improvement, to on the back end, from all the complaints.
From all the
Wow.
complaints. Yeah. So,
That is tremendous. And for those, that are not familiar with the industry, I mean, grievances are big and real for health plans, and they are monitored by the Center for Medicaid and Medicaid Services, and they do quantify and they do impact your star ratings and all the stuff. So
correct.
and there's a lot of work that gets done, and as I mentioned in previous shows, grievances are the right of members. If they're not happy about a service rendered, they can complain to the plan, and they seek basically a different approach, or different service, or different alternative opportunity for themselves. And again, when they're not happy, customer satisfaction is low, health plans are not very pleased, nobody's happy, the members are not happy, it causes a lot of problems. So services that can turn that tide back and give these members a better experience. Again, I've always talked about the Disney magic, a magical experience, from that health plan. Then that actually changes the dynamics for the plan, and ultimately puts you guys as a service provider and logistic provider at the highlight, and really at the pedestal. So that's great to hear, man. I mean, it's good to hear, about all the I guess the innovation, the processes, the different things that you've put in place, you and your team over the last few years, and where you are today. From the iHealth channel, iHealth Radio, I do wish you again a continuation of all the success, and tremendous contracts, and a lot more people that you can serve, and provide much needed help, especially going in the next phase after COVID. I mean, things are going to be different. Transportation is going to be logistical, necessary. I mean, right now Amazon and UPS are working for goods and services, but for humans being transported back and forth to certain things, medical, it's going to help, in a lot of ways. So I want to thank you for joining us today.
thank
And
you. Thanks for having me.
it was really great catching up with you. And is there anything you want to share before we part here? As an advice, or
Yeah. Listen, I just, for all those who are listening, you know, and those that are in healthcare, thank you so much for your service. Thank you for, what you've gone through in your own way, having to not only take care of your families, but taking care of the families of others. We really appreciate what you've done and the service that you've provided. In healthcare, it's just not now. We've always been frontline, but I think now we're being highlighted. From the medical professions to even administrative assistants. Everybody's important, everybody's essential. And thank you for your service to everybody who's listening on this podcast right now.
well, that being said, Steven, thank you for
Thank you,
watching.
Ishan. Thank you
This
for
is
having us.
no problem, my pleasure. So this is Hurricane Age. Thank you for watching the iHealth channel and listening on iHealth Radio. Until the next show, have a great day, great night, stay safe, and we'll talk soon.
Take care.